Hi guys. All right, I'm going to start first with the nursing process because that's the one I have up in front of my face. So just as a review, the nursing process incorporates the 5 steps: assessment, nursing diagnosis, planning, implementation, and evaluations. Again, you must know that assessment is all that very first step where you're assessing all of the data. You are including subjective, what the patient says, and objective, what you as the nurse can see. Nursing diagnosis is never medical diagnosis. It's a problem identified by you as the nurse and what you're going to do to take care of that problem. Again, go back over priority nursing diagnoses. How do we know which ones are priorities? So again, it's usually it's those actual nursing diagnoses, not a risk for, or not the knowledge deficit or the readiness for enhancement or learning or whatever. So kind of go back over that one. Again, the planning stage is where your goals and outcomes are identified. Implementation is the action stage where this is going to carry out what you plan to do. And this also incorporates teaching. And then your evaluation is you're going to see if the goals and outcomes were met. And whether they're partially met, fully met, or not met at all. We said that the nursing process is dynamic and can be very changing. Also, when you're thinking of those goals, keep in mind the SMART acronym. So specific, measurable, attainable, or achievable, realistic, and time. Okay. When you're going through nursing assessment for drug therapy, you are wanting to make sure that you're looking at their history. So again, having an idea to go through patient's chart, or as you're doing your assessment, you're looking at all of the patient's history of drug therapy, like what kind of chronic conditions they have. Do they have any past experiences or illnesses related to drugs? Again, when we're looking at the allergies, you have to ask them what happens when they take that medication. It could be a true allergy, which is can be potentially life-threatening, or something like hives, the anaphylaxis, or it could be more of a side effect like a diarrhea or GI upset. Again, we look at physical examinations because we want to know and make sure that there's no contraindications or special precautions for administering any drug type. So again, a contraindication would be like during a checking my patient over, and if they seem to be having like a low blood sugar reaction, and I assess their sugar and it's very low, and they were due to have insulin, I would not want to give the insulin because it could drop the sugar even more. So again, it's done to see if there's any reasons why we would not give that examination. Things that can also influence drug therapy is a patient's weight, their age, and again, pediatrics is its own ballgame, but for geriatric, the physiological natural processes that the body undergoes during aging can make them more sensitive to medications. Okay. So again, I'm just saying that go through your 5 steps of your nursing process, be able to pick out in a scenario which portion or part of the nursing process we would be asking for. Is it the assessment part? Is this identifying? Is this the planning part? Is this the evaluation part? What is done in each one of those scenarios or processes, okay? Again, go back to your rights of medication. We would certainly test you on the 7 that you learned in 117. And you need to be know those, okay? And also I think that's about it. So as I said, sometimes we have more than the 7 drug rights. We used to do 6, but we would hold you to the 7 ones. Okay, for evaluation is just, again, making sure that in that evaluation we are looking at, did the patient meet those goals or outcomes? And again, at that point, if they were not met, Why weren't they met? And do we go back into the nursing process and adjust something in order to hopefully help that patient achieve that goal? Okay. So let's see, I think it's slide 10 that goes over every single step that better gives you an example. And so if you want to look at that and make sure that you have a good understanding for each of those steps and scenarios, okay? On slide 11, it was the medication orders about there's rights to med administration, but there's rights to the actual order for that medication as well. And if any of those pieces are not in that medication order, you as a nurse are responsible to contact the provider to clarify that missing information. So again, it's patient's name, date, name of the drug, dose, route, frequency, and any special instructions as far as like parameters, like hold if the systolic is this or heart rate is this. And then again with PRNs, it has to be indicated for a use. The patient has to take it for that use. They cannot, again, legally, technically, you're not supposed to give them a PRN medication for something that it is not ordered for. Okay. All right, so that is it with the nursing process. Okay, so now I'm going to go to the pharmacological principles. So just again, keep it in mind that medications are not always just prescribed. They do include illegal or illicit, over-the-counter, herbals, and or like vitamins or supplements. Okay. Again, knowing when we talk about therapeutic effect, meaning is the medication eliciting that response that we want it to? Is it therapeutic for the patient? So again, example, if we gave a pain medication, does the patient, prior to giving the medication, maybe they have a pain of 10, an hour later their pain is reduced to a 4, so that is a therapeutic response. Adverse reactions tend to be negative responses or side effects to the medication. We do know that drug information is constantly changing. As a nurse, it is very important to understand why you're giving the medication. And also we look at knowing that drugs are given via different routes. And again, we'll talk about that. And generally, we cannot just change the route of a medicine. That would be an order from the physician or the provider. As mentioned, you could change the form by calling the pharmacy, and the pharmacist can send an equivalent. So again, if it was a Tylenol, they couldn't swallow the Tylenol, but the exact same milligram dose just came in a different form as a liquid, then you're okay. But I could not ask for a suppository if they had the tablet ordered. Okay, go back over and understand what the definition of pharmacodynamics is, and that is simply just what is the intended goal of the drug. Is this the therapeutic effect? Okay, and again, I said basically drugs are going to do one of a couple things. They're either going to interact and block a response that we don't want happening. So when patients take pain pills, it will block like these pain receptors, or do we need to obtain a response? And so again, we're giving sometimes stimulants because we need to elicit a more of a stimulation for the body. Slide 6 talked about the pharmacokinetics and what pharmacokinetics is, and that is what the body does with the drug. So look at that absorption, distribution, metabolism, and excretion, and be familiar with the terminology for there. See, again, with the therapeutic effect and thinking about the slide 7 was just saying that when you take that pill, what is the onset of action? So some of it can be very rapid depending on the route. Some of it takes a little bit longer to onset, like oral pills, and then each medication has a duration of action, meaning it may last 3 hours, 2 hours before it terminates, or it, you know, that minimal effectiveness is, or that minimal effect is gone. With distribution, or with the dynamic equilibrium. And this got back into, again, the absorption, metabolism, excretion, and so forth. On slide 9, we talked about this being important because we have to know that various oral, so we can have various oral preparations of medications, and depending on what type of preparation it is, it will indicate if it's the fastest that's going to be effective or if it's the slowest. So looking at the very fastest, it was the buccal tablets, oral soluble wafers, then it went to elixir, syrups, and so forth down. The slowest was the enteric-coated tablets. So with the absorption, it's what happens from the time the drug goes into the body until it goes to that blood, to that blood system and into the tissues or the targeted organ. And we know that drugs absorb at different rates, and there's a lot of different reasons why drugs, the absorbency can be different as well. Okay. All right. One thing we said about enteric coated is that those tablets cannot be crushed because they are specifically covered with this special coating because of where we want the medication to be absorbed at in the GI tract, or to help try to prevent the medication causing too much of a GI upset. On slide 10, it was going through and being familiar with what are the different routes of drug delivery. So if it was the parenteral, again, parenteral is anything that is going to be like IV or IM, sub-Q, or is it going to be enteral, which is your orals, okay, or you can have topical. And we know that IV absorption is the very fastest because it will go right to the bloodstream. Sublingual, so we know oral, and then with sublingual, we know that patients will, what they'll do is you'll want to have them lift their tongue if they can, and you're going to take the tablet and you put it underneath the tongue, and it will slowly or sometimes rather quickly absorb into the patient's body and go systemic. We know that different things can impact the absorption of oral meds. So we said acid changes in the stomach. Some foods are supposed, or meds are supposed to be taken on an empty stomach for better absorption. If the patient eats, it can decrease the effectiveness or the absorbency of it. Again, if you have an enteric-coated medication and you eat large amounts of food with it, that could inhibit the absorption. Surgical procedures on the stomach. Okay. And then again, sometimes with food or fluid. Okay. With the parenteral route, I think you guys have covered that pretty well. 117. It's just, IM is muscular, sub-Q is into the right under the skin, where it's more slowly absorbed into the circulation. What is an intradermal? With transdermal, a couple things with that, and again, I don't know if we mentioned this, but so transdermal, I don't think I did. You must put gloves on. Because the thing is that if you get that ointment or solution on your hands, it can actually affect you. It can go in systemic in you, and you can have a reaction. So you put your gloves on, you would remove the patch, you're going to wipe that area off, then you're going to take a new, the new medication or the new patch, and you're going to pick a different site to put the patch on. Also, which I don't think we mentioned, is on that patch, you should have your initials, date, and time, so that way the next person would know that that patch is the one that they're supposed to be taking off and it was placed and so forth, okay? So transdermal patches, wear gloves, remove the previous patch, wipe the area, put it on a new site, and then initial, date, and time it, okay? And you, again, some of the things to understand for topical route are also is eyes, ears, nasal sprays, lung nebulizers or inhalers, and then your vaginal or rectal cream and suppositories. Okay, distribution, again, is that movement of a drug into the body's tissues, and the biggest concern factor was the tissue perfusion, because we said that drugs go to the areas of biggest blood supply first. drugs go to the areas of biggest blood supply first, and that would be heart, liver, kidney, and brain. And so I have to have adequate tissue perfusion in order for that drug to really be distributed. And so if I have inadequate blood flow to an area, it will not distribute that drug appropriately. So again, like if a patient's very cold, the blood vessels will constrict. If there's decreased blood flow to that area because there was maybe a clot or something like that. Okay. Go back over what the first pass effect is. And so again, usually what happens is when the patient takes a medication, and again, think of your oral medications, it will go to the GI tract first, and then it's going to go to the liver to be treated. And the liver's job is to detoxify it, some of the chemicals, and to use other parts of it that's needed for that therapeutic effect or needed for metabolism. Okay. Okay. And so the portion of the drug that gets through that pass first effect is what's going to go into that circulatory system and throughout the body. The IV medications will bypass the first effect because again it goes straight into the bloodstream, where the oral medications, again, they do not. They have to go to the GI and then they'll go to the liver. So read about that. We just talked about excretion and why that's so important. So again, there's various routes that the removal of a drug can come from: skin, saliva, lungs. Kidneys are the most important organ for excretion. We want to check patients' kidney functions test, which is your BU creatinine and GFRs. And we also want to check a patient's liver because, again, a lot of those medications are getting metabolized by the liver, right, and detoxified and so forth and filtered. So we would look at the AST and ALT. If the kidneys are not correctly functioning, then a patient can become toxic because that medication, all those byproducts are building up in the patient's body. And again, you get these toxic levels, so that's very important. Okay, go back over what the definition of a half-life is, and again, what is the importance of it. So again, the half-life is really just that amount of drug in the body that that it takes to wear down by half of the strength. So with the half-life, again, maybe a little clearer definition is when you have a medication, the half-life of the drug is the time it takes for the amount of it in your body to be reduced by half. So half-life, so the amount it takes for in the body to be reduced by half. So again, the example was if you had a medication that, for instance, was 20 milligrams of a drug and it has a 2-hour half-life. Well, when you go, so how, what would be half of that, right? So we just keep dividing by 2. So the example was in 2 hours, it would be down to 5 milligrams. In another 2 hours, you divide it again by half, it's 2.5. All right, and so forth. So take a look at that. Again, kind of just different factors that influence the effects of drugs. We talked about already gender, physiological, pathological, genetic, immunological, so just some different things, environmental. You should know the definition for tolerance. So we said that tolerance can develop for different reasons. So a person that's taking a same strength of a medication, medication for a long period of time, their body gets really used to it, and it's no longer as effective as when they first started that treatment. So that's tolerance. It is different than addiction. Okay. Excuse me. Okay. All right. I think that was actually it with that. I don't see the talking about the picture, or maybe I bypassed the one like they had the grapefruit and so forth on it. I guess just a blurb keeping that one in mind again about uh, medications that can be incompatible. So we talked about there are certain foods or fluids that are not compatible with certain medications, or a lot of times you may have a patient on more than one IV medication and it's not compatible with another one, so that kind of makes it a little different of how you'd administer it. Um, so like I said, I don't know where that slide is offhand. Oh, here it is. I found it. Okay. Another example was like with tetracycline, it can't be taken with dairy products because it can bind with the calcium. And remember when those that protein binding, this is kind of an example when things bind, it's not going to go to the target area and be effective. So those were just those kind of little caveats about that. Other than that, I think that is it, guys. Have a good weekend.